good quality meat as well. We want to make sure organic, hormone-free, pasture-raised makes a big difference. Then we move on to our sleep. We want to really stress getting a good night's sleep. That's when we rejuvenate, when our sperm rejuvenates, our eggs rejuvenate. There are so much we can do to begin this awesome natural fertility journey. So let's talk about making changes in our life. So if we've had the standard American diet and the standard American lifestyle, there's probably a lot of things we can do to improve our chances of healthy pregnancy and a healthy baby. So let's start with the diet piece. We want to eat really good, clean foods. We want organic as much as possible, and if we can't buy everything organic, we want to look at the Dirty Dozen and the Clean 15 list. Those are really helpful. We want to eat lots of vegetables. That gives us our phytonutrients, our macronutrients, our micronutrients, our antioxidants, all extremely important to our health, the quality of our eggs and the quality of our sperm to make a healthy baby. And good quality meat as well. We want to make sure organic, hormone-free, pasture-raised makes a big difference. Then we move on to our sleep. We want to really stress getting a good night's sleep. That's when we rejuvenate, when our sperm rejuvenates, our eggs rejuvenate. 7 to 8 hours a night, trying to go to bed at the same time every night, waking up at the same time in the morning. We also want to have in place a way to become more stress resilient, I like to say. So whatever that might be for you, is it a yoga practice daily or a few times a week? As far as stress resilience, we want to have in place something that helps decrease our stress level. So get us from more of a sympathetic state to a parasympathetic state. Parasympathetic is more of our relaxed nervous system being engaged. So we want to have something in place. Maybe it's yoga. Yoga helps us to feel relaxed and get us in more of that Zen space. Or if it's meditation, meditation is a great way to quiet our mind and to help lower our stress levels. And anything we can do to help lower our stress levels during the day are going to make a big impact on our body, because then at night when we're sleeping, our bodies don't need to send all this energy to decrease our stress levels if they're already been pretty decreased during the day because we've been able to add these practices to our life. Then our bodies can work on the things that we really need to do during sleep, which is rejuvenate all our cells that have been working really hard all day long. And so that process can happen more naturally and as it should happen, rather than our bodies being attentive to the stress piece and changing our sympathetic drive to our more parasympathetic drive. And then there's also, we can look at testing to find a baseline before we try to conceive, or if we're on the journey to conceive, we can look at baseline labs. For women, we like to look at day 3 labs, and that's day 3 of your menstrual cycle, so the third day of bleeding, and third day. And then we want to look at your estradiol levels. We want to look at FSH, LH, prolactin. And we can add an AMH in there, but it doesn't need to be on day 3 of your cycle. That piece of the puzzle will give us some information as well. So we could definitely look at that. And for men, yes, a semen analysis to start and give us a baseline of what his sperm look like is a wonderful way to start the journey as well. That's a good question. Everyone that we work with that has been struggling to get pregnant, absolutely. I think it's really important to have these labs because it gives us a better idea of what the root cause of struggling with fertility might be. For couples that are just starting out and just want to know, hey, what are the best things that we can do to optimize our chances? I don't necessarily recommend doing day 3 labs or a semen analysis. Those things aren't necessary, but depending on the history, the age of the couple, and the health of the couple, the menstrual cycle of the woman? Are there signs and symptoms of PCOS or endometriosis? If so, maybe some of those things would lead us more to, okay, let's go ahead and get day 3 labs sooner than later. Yeah, absolutely. The body types have been categorized in different parts of the world and different health systems, and Ayurvedic medicine touches on or mentions, and Dr. Amatma, who I trained with, has mentioned a piece of Ayurvedic medicine, and that's the body types. And there is the Vata, the Pitta, and the Kapha body types. And with these body types, there are certain characteristics that help people fall under a specific body type, and then sometimes people can relate to more than one body type, which is absolutely fine as well. But it just can give us some general guidelines on what things we might need to change or suggestions we might make to a person with a certain body type versus another person with a different body type. Yeah, the fertile window, I like to refer to the American College of Obstetricians and Gynecologists. They refer to that window as about 6 days, and that is because sperm can live in the woman's body up to 5 days, and then the eggs can survive or normally survive about 12 to 24 hours. And with that timing and knowing when ovulation is, there is about a 6-day fertile window, so to speak, where at least American College of ACOG, we'll call it, American College of Obstetricians and Gynecologists, recommend that a couple has sex every day or every other day during this 6-day window of opportunities. If you want to learn more about optimizing your health and your fertility, then follow me and subscribe to learn more.